Hi, I'm Melissa.
And I'm Maria, and you are watching Questions and Answers Part 2 of Dermal Talks.
So since releasing our first question and answers video, Maria and myself have been getting a lot of direct messages asking us questions about what it's like being a dermal clinician, the study and the industry.
So last week, Melissa and I posted a question on our Instagram stories. They should be presented here, asking what you guys would like to see us include in the part 2 of Q&A. So we've collated a few of these questions and we'll answer them for you in today's video. So Melissa, first question. What's it like studying to be a dermal clinician at university? Is it a lot of work?
Well, I always feel a bit old when I answer this question, but Maria and I have finished studying the Bachelor of Health Science in Dermal Therapies almost 7 years ago. Isn't that crazy?
Mm-hmm.
So when I finished VCE in high school, I had to have an interview to apply for the Bachelor of Health Science. So at the time, you needed to have a score of about 20 or something in English and have a diploma of beauty therapy. So because I was coming out of high school, I then had to apply for the Diploma of Beauty Therapy. I completed this full-time in 12 months, then was automatically transferred into the Bachelor of Health Science in Dermal Therapies, which was 3 years full-time. I suppose to answer the question, yes, university is a lot of work. I worked part-time for those 4 years while studying full-time. Time management is really important and you need to keep on top of lectures, tutes, and course deadlines of assignments. You need to learn and understand the anatomy of the skin, physics of the lasers, and love reading journal articles.
Mm-hmm.
I understand now Victoria University has a block mode, which is meant to make study more manageable as you learn one subject over 4 weeks rather than 4 subjects at the same time over 1 semester, which is what we did. We also had exams at the end of that semester, but from what I've heard from current students, there aren't any exams at the end of semester and the structure is totally different now. The next question, Maria, is it all written theory?
A lot of the study is theory-based. However, there's some reasonable amounts of practical work. When we were undergoing the university degree, the course had a mixture of theory, practical, and a whole lot of clinical evidence-based studies. So being the journal articles that Melissa mentioned before. If writing isn't for you, then maybe you would find it to be a little bit challenging. However, if you have your passion and you genuinely want to be in the industry, the knowledge that you'll be obtaining from everything that you're writing and reading is eventually going to want you to continue so that you can continue learning more. It's not all written theory, but majority of it is because you are learning something. So what qualifications do I need to become a dermal clinician?
So we touched base on this in our first question and answer video, but according to the Australian Society of Dermal Clinicians, to be eligible to use the title Dermal Clinician and to gain a full membership in the society, you need to have graduated from an endorsed bachelor degree. Currently, the Australian Society of Dermal Clinician recognises these programs, which I will leave a list on the screen. I will also leave a link to the ASDC website below in the description box so you can see these lists of courses. Okay, the next question is a dermal therapist more specifically affiliated with acne, scarring, and aging?
Now, for this, it's what I understand it to be when it comes to dermal clinicians or dermal therapists, because we are working with 2 different types of qualifications, which would have been stated in our first Q&A. So therapists and clinicians work similarly the same. When I say that dermal clinicians are more evidence-based, it's because our degree or our bachelor's incorporates clinical papers and evidence-based facts. Therapies or dermal therapies, to my knowledge, so please correct me if I'm wrong, I mainly focus on the theory and the practical of set tasks and treatments. So with all of that, we can work to aid and manage acne, scarring, and aging in a similar manner. Obviously, the degree of which is then based on where you're working, what you're exposed to, and what you have experience in. So that could then fall back on the degree itself. The comparison of a naturopath and a dietitian. They both have similar understanding. They both have a similar degree and understanding of what is done. One is more mainstream, and then one can work in medical settings. So although it's not a hardcore fact, it's still something that is a nice analogy that people can understand. Okay, they're two of the same, but one can do this and one can do that. Kind of like the question, which like, what's the difference between an osteo, a physio, and a chiro? They all do similarly the same thing, but they have different focuses in how they manage set tasks. So that may be a better way to answer or create an analogy to answer that question. Yeah. It was a little bit of a ramble, but hopefully that makes sense to you guys as well. So, Melissa, what made you do the course?
So it can be hard to know what you want to do for the rest of your life when you're 17 or 18 years old. But one thing I know for sure is that I wanted to go to university and study straight after high school and get it out the way. So the field of dermatology always interested me, and having acne as a preteen and seeing a dermatologist, I wanted to know more about this profession. At the time, you needed an ATAR score of 90 plus to study dermatology, and I simply didn't meet this requirement. So I went to the uni open days and I came across the Bachelor of Health Science in Dermal Therapies stand at Victoria University. And after reading up on the course, I knew this was for me. Maria, the best advice you would give to someone studying and working in the dermal field?
Okay, so I'm going to give this advice, obviously based on my own experience. When you're physically applying the information that you're learning at uni, it allows you to learn and retain the information and build more confidence in what you're actually learning at the time. So it's a huge benefit and a positive outlook. However, when it's studying and work, you also need to learn how to switch off. Do something fun, do something that's going to help keep you sane so that you're not burnt out on what you're learning and what you're applying. But I feel like being able to do it is a lot better in retaining and learning more about the information. Because Mel, I don't know if you can input with this. When we were working together, having both of us had done the degree, we were talking to each other based on what we learned at uni. Like when we were dealing with the machines, we were like, oh yeah, we've got to change the milliseconds there. We've got to do this. We've got to do that. And some of the other girls were looking at us like, what are you guys talking about? So it's really good that you're able to apply on hands-on experience and in real life situations what you're actually learning at uni. Mel, so talking about that, what's the best way to get your foot in the industry as someone studying dermal science?
So I guess the first thing would be to make sure that your resume is updated and ready to go. Join the Australian Society of Dermal Clinicians. They have a private Facebook group and they post job opportunities where you'll see first, specifically wanting dermal clinicians. Something else you can do is go to conferences as much as you can. It's a great way to learn and connect with others. Search for clinics in your area that you would like to work at and inquire if they're looking for a dermal clinician. Connect on social media with other dermal clinicians. We are still a pretty small industry, and I think it's great that we can all support one another. Maria, have you ever worked alongside any other healthcare professionals?
Okay. Mel, I'd actually like you to answer this question as well, because we both have worked at different places. I've got, with my work experiences so far, it has been more common to work with nurses. especially because when we're looking at certain treatments, it's also in conjunction with some injectables. So I find that I have worked mainly with nurses doing injectable treatments. I've also worked at a doctor's, a cosmetic physician. There's an interesting unit at uni where we purposely worked with other allied health students, which was actually a really good insight. So if you have the opportunity to do that at uni, it's a great way to network and learn how to work interprofessionally with other people in the healthcare sector. You'll find that when you're working, you'll be working mainly with similar people, but if you do have the opportunity to work interprofessionally, you'll find that you're going to be connecting the web of client care and advice a lot easier and better for clients as a whole optimal and lifestyle benefit for them. Mel, who have you worked with in the healthcare industry?
Yeah, I guess when you do study the bachelor, it opens you up to more pathways, not just to work in clinics with other dermal clinicians, but alongside other healthcare professionals. So I personally have been working underneath a plastic surgeon, as well as nurses and doctors and dermal clinicians at my clinic. And it's really great that we collaborate, we discuss difficult patients or treatment plans. So that's something, if you're wanting to sort of look into, make sure that you're connecting with others and complete the Bachelor of Dermal Sciences course.
Okay. And Mel, I guess mainly your next question, what would be the difference between offering skin-based treatments and allied health?
Okay, so depending on who you work for and where you work, it can be common to get patient referrals. This could be from a hospital, a dermatologist at another practice, for example, or from other dermal clinicians. So formal referrals often happen when you are working under a doctor, plastic surgeon, or dermatologist. As dermal clinicians, we are not an independent registered healthcare provider. So we can perform skin and laser treatments on behalf of our doctor colleagues, but we do not have an item number, unlike a doctor or dermatologist would have. Maria, is there a difference in terms of roles between a dermal clinician and a dermatological nurse?
Okay. Yes. So with what I've been able to find as I've kind of been wanting to go down that path, is that a dermatological nurse is primarily a nurse. Usually they are a registered nurse or an RN, not an enrolled nurse. So that's a different layers or a different type of nursing degree, I should say. After nursing, they can choose to specialize in a field of choice. So I know nurses that work in burns. I know nurses that work like a midwife where they solely work with babies. These nurses choose to specialize in dermatological conditions. So the similar focus to that of dermal clinicians. The biggest difference is that dermal clinicians are primarily clinicians and not nurses. However, they can go and do nursing afterwards. So the biggest difference, I guess, that I've been able to find just on a, just from front vision, I guess, is that dermal clinicians are not able to inject, whereas registered nurses can. We are both legally unable to diagnose medical conditions, which is similar to what Melissa had mentioned before, where we do rely on medical practitioners to diagnose something, and then we can work based on their recommendations or based on their diagnosis. So although we are unable to diagnose these medical treatments, being nurses and dermal clinicians, we can rather assess the physical appearance, and that we can then use that information to refer or to recommend to go and see a doctor for further medical diagnosis. And then we can essentially help to treat the concern in a similar way. Was it hard finding a career as a dermal clinician after uni?
Yes and no. I remember being in my last year of studies and stressing about where I was going to work because I didn't have a job yet in the field. I think the best advice would be that if you get a job, take it, even if it's not your first preference. You can use your first job out of university to build your consultation skills, learn about new equipment, and gain confidence in all aspects of dermal therapies. Once you have experience, you can then move on, as finding a job should be a little easier now that you have some clinical experience, or you can stay on board if you are really enjoying the workplace that you're currently at. Maria, do you recommend joining the Australian Society of Dermal Clinician as a student?
Definitely. It gives you an insight to what dermal clinicians are facing outside of uni, and it also gives you an idea of what you will be facing on a day-to-day basis in the working field. The opportunities are infinite, and the topics are relative to what you will face on a regular basis. So it's a really nice way to see after uni if there's an area that you'd like to specialize in, whether it be wound care or lymphatics or anti-aging or chronic conditions. So these are all just previous topics of the association's conferences. Plus the extra perk is if you sign up as a student, you get an extra discount. So they do know that you're a student. They do know what's happening. So I would say jump on board. You've got the support there from everyone else that's in the industry. I like this question. Do you learn things that can be applied to your own personal life?
Yes, definitely. I had no idea about cosmeceutical skincare and what I should be using on my skin, but you get to learn all about that, as well as wound healing, the anatomy of the skin, and skin health in general. And you'll be surprised at how many questions you get from friends, family, and even random people when you tell them your profession.
Yeah, it's definitely a point of topic at some situations. I can say, hey Mel,
can you check what this thing is on my back?
And I'm just like, oh, I have this. I don't know if it's psoriasis, but I've just been using this cream. Is it going to help? And you're like, no, but I'll give you unsolicited advice. Mel and I would like to thank you for joining us today, and we hope that you have found this interesting. There were many other questions that we see fitting to actually make a whole video out of. So if any of your questions from today have not been answered, it means that we're putting together a video for it. Now, if you do have any further questions, do not hesitate to DM us. We love these questions because it means that we can do another Q&A. So you can always message me on my Instagram, so being Maria_Dermal Clinician. Mel?
And mine is melissa.dermalclinician. Thank you for watching this video. Please remember to like, subscribe, and leave a comment, as it supports our channel, and we'll see you in the next video. Bye.
Bye.